So when a patient needs a tooth extracted, it's not something which any of us look forward to. But as specialists, we want to try and make that procedure as predictable and as pain-free for the patient as possible. Say we extract a tooth, we've got to think about replacement options too. The ideal replacement option for a missing tooth is a dental implant. And the reason for that, it's a standalone tooth. Now, in most offices, what will happen is, let's say that this is the tooth in the socket. The tooth comes out and the patient is told we have to wait for it to heal, and the socket collapses. And then 6 months later, the dentist comes back and attempts to put an implant into that same site. But that socket is collapsed. Now we have to ask ourselves, is there a better way to do this? There has to be, and we've been doing this for the last 10-15 years. When we extract a tooth, we put an implant in the same day to prevent the socket from collapsing. The beauty of this is that the patient only has to go through one surgery, right? They don't have to go through 2-3 surgeries to have an implant placed. The same day the tooth is removed, the implant is placed. Now, if it's a front tooth, it gets even better. Imagine you're going to lose a front tooth. Nobody wants to walk out of the door with something that comes in and out of their mouth, right? So we extract the tooth, we put the implant in, and we provide the patient with a cosmetic temporary, which is fixed to the implant. It's a permanent tooth on day one. Now, how do we do that? It's technology driven, it's expertise driven. We have specialists in surgery, which are periodontists. We have specialists in restoration, which are prosthodontists. We have lab technicians on site who fabricate the tooth. We have CT scans, we have advanced surgical guides where we can place the implants precisely and provide the patient a tooth that very same day. They come in with a tooth that's going to be extracted and they walk out with the tooth. Patients come in and they want to leave whole. Our practice philosophy is to be able to do that whenever we can, so that the patient doesn't feel inadequate that they don't have a tooth. Whether it be a front tooth or a back tooth, we try to do it with all teeth.